Last year, the film The Good Nurse was presented on Netflix, telling about the life of Charles Cullen, who injected lethal injections to hospital patients. The scenario is based on the real details of the capture of the elusive cleaner. So who was this angel of death, as the press called him, and why did the public rebel after a harsh sentence? They say that director Darren Aronofsky postponed all projects in order to complete the shooting of The Good Nurse last summer. The story of Charles Cullen hooked him so much. The scenario group, together with the director, even asked for a date with a real serial killer, but the representatives of the supervision responded with a strict refusal. 11 life sentences, 40 ruined lives, 360 more of those whose deaths could not be proved, plus several loud statements by the nurse himself during the trial, where he provocatively stated that he was doing a good deed. After all, he relieved the suffering of patients. A federal judge is still angry. Is a brutal killer worthy of giving him his word even after 16 years? Especially the one who traded for the right to life for the sake of cooperation with the investigation. The world's forensic psychiatric practice claims that behind every serial killer there are great psychological traumas, a catastrophic fracture in childhood which disfigure the psyche in such an elusive way. In this regard, Cullen's life was like a textbook. The youngest of 8 children of bus driver Edmund Cullen, Charles was born in 1961 and grew up sick and constantly humiliated by the guise of his older sisters as a child. His father died when Charlie was only 7 months old. His mother was involved in a fatal accident that year when Cullen was in his senior year. For some reason, then the hospital refused to give the mother's body to the family to cremate him, which was a big shock for the youngest son. Later, he admits that the choice of the profession of a nurse was due to figuring out what was wrong with the U.S. medical system. After his mother's funeral, Charles dropped out of school and joined the U.S. Navy while hiding from the medical board that he was being monitored by a psychiatrist because of his suicidal tendencies. As a teenager, Cullen tried to commit suicide several times, but each time doctors managed to pump him out. Cullen rose to the rank of Petty Officer Second Class in the team that controlled the ship's missiles Poseidon, which in itself is surprising, because here he was constantly subjected to humiliation and bullying by colleagues. Thin, secretive, caustic, easily depressed, a drinker, he was and felt like a permanent outcast in the Navy. One day, a friend found Cullen sitting at the rocket control panel in medical gloves, a surgical mask, and with tweezers in his hand. Charles could not explain what he was doing in this form in the control room. Without making a fuss, the foreman was transferred to the supply department. There are 2 more suicide attempts at Cullen. He is registered with a psychiatrist and demobilized in 1984. Mental health problems are layered with alcohol problems, but this huge but did not prevent Cullen from getting a nursing school diploma at Mountainside Hospital in New Jersey. He starts working at the Burn Center of St. Barnabas Medical Center, where he meets his future wife, Adriana Baum. They get married in 1987, and a daughter, Sean, is born. It was while sitting on maternity leave with the baby, Adriana began to notice oddities behind her husband. He loved to mock dogs, beat cats. Once she found a kitten crucified in the backyard. In addition, her husband could pour lighter fluid into tea for friends, burn all his daughter's books for no reason, or forget her for a week at the nanny. Baum filed for divorce 5 years later and even obtained an injunction against her husband approaching their house by 500 meters. I was afraid of him. His calmness with which he committed domestic cruelty, his quiet grin, his rustling voice. Even a few years after the divorce, I went to the window in the evening and pulled the curtains. It seemed to me that he was watching us all the time, she later told reporters. And what was our hero doing in the meantime? In 1988, he got a job at St. Barnabas Hospital, where he first injected a patient with a lethal dose of insulin. As he will tell in an interview later, for the first time in many years he felt happy. He helped the other to find peace. The first victim was followed by a second, a third. A series of suspicious deaths continued in the hospital for 4 years, but the management decided to conduct an internal investigation only after a patient who was about to be discharged suddenly died. Evidence of the dropper showed that it contained a horse dose of insulin. Other medical records were brought up. All deaths occurred during Cullen's watch. Do you think the head doctor went to the police? No, Charles was quietly fired, and they tried to hush up the case. A month later, Cullen got a job at the Warren Hospital, where he killed 3 pensioners with a huge dose of heart medication. His last victim before his death said that a sneaky orderly gave her an injection, but family members did not believe her. Curiously, it was at this moment that the serial killer's divorce from his wife ended, and Cullen even wanted to quit working altogether, but the alimony was so large that he had to continue. It turns out that if there had been no divorce, there would have been no new deaths. Of course not. This is the cunning logic of the murderer, who later tried to appear in court either as a deliverer from torment and a sick old age, or as a victim of circumstances. A kind of little man who wanted to help the same little people. After the divorce, several harassment claims will be filed with the police immediately. Because of one of them, Charles will receive a year of probation, and the next day he will try to commit suicide again. Black depression again, psychiatric treatment, therapy, but that's what's amazing. At the same time, no one suspends Cullen from work. There will be a commotion at the new place of service when a 91-year-old patient raises a scandal because her nurse was changed. Like there used to be Susie, and now some man is giving her injections. They've made a mess. The next morning the old lady will die. The outraged son of the deceased forced all medical workers to pass a lie detector, which Cullen, perhaps due to the lability of his psyche, easily deceived. Another murder remained unsolved, for the time being. Then there was work in cardiac surgery at Hunterdon Medical Center, then the Liberty Nursing and Rehabilitation Center in Allentown, then Eastern Hospital in Pennsylvania. In each, Angel of Death injected patients with shock doses of pacemaking drugs that led to instant death. Many of the elderly deceased were not sent for autopsy, putting the cause of death as the consequences of the diagnosis with which they were admitted to the hospital. Meanwhile, Cullen's blacklist was already going to dozens of patients. You may ask how, with such a dubious biography and psychiatric problems, Charles was hired again. They took it with great eagerness. Due to the lack of medical staff and the lack of a unified database of medical workers, it was difficult to track Cullen's dubious reputation, especially since he changed staff every time and did not get a job at the hospital next door. Plus, clinics that provided a lot of paid services were terribly afraid of a scandal. It was easier for them to dismiss a strange nurse suspected of stealing drugs, and he really stole them in large volumes, than to survive the hype that would begin if the truth that surfaced turned out to be so terrible. And only the management of the Somerset Medical Center in Somerville turned out not to be cowardly. The hospital's computer system increasingly began to show that Cullen was accessing patient records to which he was not attached. Plus, a quiet nurse began to notice other people's patients in the wards. Charles often requested medications that were not prescribed to his patients. This is not counting suspicious behavior with requests for narcotic drugs. He then made a lot of orders, then cancelled them and requested again. In July 2003, the director of the New Jersey Investigative Information and Education System told Somerset doctors that 4 suspicious overdose deaths indicated that someone was killing inside the clinic. But the hospital postponed the appeal to the authorities until October. By that time, Cullen had killed at least 5 other patients and tried to kill another one. On this attempt, he got burned. The head of the hospital wrote a statement to the police. Cullen was followed. The microphone was hung on his colleague Lynn Tester, who forced the nurse to make some confessions in conversations. The medical maniac was arrested in December 2003. He immediately confessed that he had killed Florian Goll and tried to kill Jin Ken Khan. They were patients in Somerset. In addition, Cullen told detectives that during his 16-year career, he took the lives of about 40 patients. But experts assure that there were dozens of times more deaths. Just years later, it would be very difficult to prove their deaths from overdoses. Part of his plea agreement, Cullen promised to cooperate with the investigation if they did not seek the electric chair for him. And so it turned out. However, at the trial, the quiet nurse behaved disgustingly. For example, shouted to the judge, "Your Honor, you need to resign." He brought all the participants in the process to white heat. As a result, the defendant was tied up and gagged. Cullen was given the floor only after the sentencing. By the way, the sentence was harsh. 11 life sentences without the right to parole. I saw how these people suffered. I injected them with drugs to prevent cardiac arrest or breathing. For some, especially the old ones, I injected large doses of drugs so that they would quietly go to the next world. I just helped them get to heaven faster. They deserved it," the convict said in his last word. At these words, Cullen's colleague Lynn Tester began to cry because many of Charles' victims were soon to be discharged home. They did not suffer from pain, but planned a happy life surrounded by children and grandchildren. But Cullen decided everything for them.